Hello everyone, I'm Dr. Prashanth or Putran, consultant interventional pain physician at Alleviate Pain Clinics, Bangalore. Welcome to this video tutorial about Biceps Tenosynovitis. Now why this topic? Because it's a very important pain generator and can cause pain, chronic pain in patients. As you can see here, the shoulder joint is made up of majorly two joints, that is the major joint between the head of the humerus over here and the glenoid cavity which comes from the scapula bone. The interface between the head of the humerus and the glenoid cavity over here is nothing but the glenohumeral joint. And then we have a minor joint between the acromion process and the clavicular bone called as the acromioclavicular joint, which is not a part of the shoulder joint per se, but becomes very important, also could be a pain generator in and around the joint. A little bit more of the anatomy. As you can see over here, the head of the humerus has a very smooth structure which we call as the articular cartilage, and then there is another articular cartilage along the inner surface of the glenoid cavity, and this cavity is filled with minimal amount of synovial fluid under normal circumstances. It is also strengthened in and around by the ligaments, and the most important structure surrounding the shoulder joint are nothing but the rotator cuff muscles which provide stability. Okay, and also another important structure, that is the fibrous articular capsule, which provides stability to the glenohumeral joint, that is nothing but the shoulder joint. So coming to the topic per se, that is biceps tenosynovitis. Okay, so as we know, the biceps muscle is made up of two heads, the long head and the short head. So the long head takes its origin from the superior portion, the superior tubercle of the glenoid cavity. Okay, and then it goes down, becomes the belly, the muscle belly, and then it inserts onto the radius, the radial tuberosity. So what's interesting to note over here is how the long head biceps tendon tracks all around lower from the bicipital groove. Now what is this bicipital groove? So as you can see over here, you have the head of the humerus and then the shaft of the humerus. At the junction you have the greater tuberosity and the lesser tuberosity over here. So between the two, in red, is marked the bicipital groove, and that is where the tendon of the biceps, long head of the biceps, lies. And from there it tracks on to go, it traverses the joint. As you can see, here is the long head of the biceps tendon, which is traversing the tendon sheath, traversing along within the glenohumeral joint and taking its origin from the superior tubercle of the glenoid cavity. So what I'm trying to say is, assessing the ultrasound is the most commonest tool which is used to diagnose shoulder conditions, because as I said about the gross anatomy, the same anatomy becomes the sonoanatomy under when we look at these structures under the ultrasound. Okay, so scanning this bit of area, that is at the bicipital groove, gives us a lot of information, not only about the tendon, but it acts as a window to what is actually happening within the glenohumeral joint. So coming to the topic, that is the bicipital synovitis. So basically it involves the inflammation around the long head of the biceps tendon. So what happens during inflammation? There is fluid collection. So the fluid appears as an anechoic shadow in the ultrasound image. Okay, but this fluid, what we see, need not necessarily be because of the tenosynovitis per se. It could be because the fluid which is actually within the glenohumeral joint tracking down along the long head of the biceps. So it actually offers as a window to be seeing what's happening within the glenohumeral joint. So where do we see these things? It could be because of glenohumeral arthritis, where there is inflammation within the joint, and that reflects as an effusion around the biceps tendon when we scan it at the level of the bicipital groove. So again, it depends on the age of the patient and the mode of injury. All these things helps us decide what are we dealing with. It could be what do they present with? So they present as a pain and the anterior aspect of the shoulder. So again we do the clinical examination and then we move on to the ultrasound examination, and based on the symptom, the age, the mode of injury, could be a rotator cuff pathology also, which reflects as a minimal effusion around the biceps tendon, we have to come to the final diagnosis. Because ultimately we are trying to treat the pain generator. So it could be at the level of the biceps tendon itself, or it could be something happening within the glenohumeral joint. As a pain physician, what can we offer in such scenarios? So depends upon the chronicity of the condition, and as I said, because of the various, could be one of the various causes. So accordingly we treat the patients in our clinics. It could be simple joint intraarticular joint injections, or it could be moving on to the newer modalities of treatment like radiofrequency ablation of the nerves in and around the shoulder joint in cases of advanced glenohumeral arthritis. So as we see in this ultrasound image, it is nothing but a world of black, grey and white. So the muscles appear with the, a fibrillar pattern with hyperechoic linear lines within them, like as you see in the deltoid muscle image, and then lower down you're seeing a hyperechoic structure between the two structures, that is the greater tuberosity and the lesser tuberosity in the bicipital groove, that is nothing but the biceps tendon, and surrounding that you can see an anechoic shadow, that is nothing but the effusion what we are talking about in this video, nothing but the effusion around the biceps tendon. So that could be a local pathology, or it could reflect what is happening within the glenohumeral joint in case of glenohumeral effusion in case of arthritis. As it is true for any condition, earlier the diagnosis and treatment, the better. So I request anybody who is watching this video, if at all they do know anybody suffering from such similar conditions, or in any case they do want to consult a pain physician, do it at the earliest as possible, and we are available for you at Alleviate Pain Clinics, Bangalore, at our various locations mentioned in our website. Thank you.